I'm Dr. Ellen Comiskey at Moreland OB-GYN, and I'd like to talk to you today about the pelvic exam. Many women have some anxiety when they have a pelvic exam, and I think knowing more about it could go a long way in relieving some of that anxiety. So let me just get you oriented. This is a typical example. There are different sizes and shapes of speculums, and they all look a little intimidating, but it's better when you realize that only the smooth, small part is inserted. So any woman who's had intercourse or has used tampons can usually have this exam without any undue discomfort. So let me show you how we use it. When we start with a pelvic exam, the patient's laying on the exam table with her hips down to the end of the table. And then we use the stirrups. Her feet go in the stirrups. I start by looking at the outside first. So I insert the speculum into the vaginal opening, and by pressing here, the sides of the speculum open, allowing me to look up through the vagina to the cervix. So as I look through the speculum, I'm able to see the cervix. At this point, we collect some specimens to send to the lab. But it depends on what the needs are of the patient are at that time. If we do a Pap Smear, which is a screening test for cervical cancer or precancer, I take this plastic spatula and I just rub it on the face of the cervix. Then I take the small brush, put it in through here into the cervix, rotate it, and then rinse both of these off into a jar and send it to the lab. And the lab looks at it under the microscope. We can also collect specimens to test for some sexually transmitted infections at the time of the pelvic exam. If we're doing that, then we take a small cotton tip swab, put it right into the cervix, leave it in there for a few seconds, and then remove it and send it to the lab. It used to be that we would do Pap smears every year when women would come in for their pelvic exams, and that's not the case anymore. Now the latest set of guidelines, the recommendations for how frequently we do Pap smears, it depends on the age and the previous history of Pap smears. So at this point, I'm done using the speculum. I've looked at the vagina and the cervix, but when I look through the speculum, I can't see any of this. None of this is visible. So in order to check the other pelvic organs, I remove the speculum and then put one or two fingers in the vagina, whichever fits comfortably, and my other hand up on the top of the abdomen, and feel the pelvic organs between my hands. Sometimes at this point I do a rectal exam. The purpose of the rectal exam is a couple of things. Doing a rectal exam helps me feel the ovaries better, sometimes much better than I can feel when I do the vaginal exam, and it also helps me just check the rectum itself. After that, the pelvic exam is finished. We're all done. So I hope that this walk through the pelvic exam has given you a little bit more comfort and answered some of the questions you have about what happens when you come in for a pelvic exam.